Hello there, viewers. Welcome to another informative video from your trusted source, Treatment Explainer. If this is your first time here, do hit the subscribe button and the notification bell to stay updated on all our health and wellness content. Today, we are diving deep into a topic that affects millions around the globe every year: rotator cuff injuries. Now, you may be thinking, that's something only athletes need to worry about. The truth, however, is that anyone can suffer a rotator cuff injury. Whether you're an athlete, a painter, a weekend warrior, or simply reaching for an object on a high shelf, rotator cuff injuries are more common than you think. They can cause significant discomfort, limit your movements, and impact your everyday life. But here's the good news: you're not alone, and help is at hand. In today's video, titled "Transform Your Recovery: Master the Art of Rotator Cuff Injury Rehab Exercises," we aim to provide you with valuable insights into understanding this common yet often overlooked injury. We'll guide you on when it's crucial to seek professional medical help, demonstrate simple at-home exercises for rehabilitation, and discuss prevention strategies to avoid future injuries. So, if you or someone you know is dealing with rotator cuff tendon pain, you're in the right place. Let's start this transformative journey to recovery together. As we set out on this journey, it's important to understand what we're dealing with. The rotator cuff is an ensemble of muscles and tendons around your shoulder joint. Picture them as the support crew, keeping your shoulder stable and assisting in lifting and rotating your arm. But just like any hard-working crew, they can experience wear and tear. Rotator cuff injuries occur when any of these muscles or tendons get damaged, leading to rotator cuff tendon pain. This damage can be a result of a single injury, like a fall or a sudden jerky movement, or due to a gradual wear and tear from repetitive overhead movements. Age also plays a factor, as rotator cuff tears are more common in people over the age of 40. The symptoms? You might experience a dull ache deep in your shoulder, disturbance in sleep, especially when you lie on the affected shoulder, and you might even have difficulty in performing simple tasks like combing your hair or reaching behind your back. The degree of pain and limitation in movement usually depends on the severity of the injury. Now, don't let this information scare you. Remember, knowledge is power. The better you understand your injury, the better you can manage it and accelerate your recovery. And that's what we're here to help with. So, let's dive into when you should seek medical help for your rotator cuff injury. Stay with us, and remember to hit the like button if you're finding this information useful. There is often a thin line between a pain you can bear and one that needs immediate professional help. If you have been experiencing rotator cuff tendon pain for several weeks, it's been keeping you up at night, or you can't carry objects or raise your arm without pain, it's probably time to seek medical assistance. Do you find yourself wondering, where can I find a rotator cuff injury doctor near me? The internet is a powerful tool to help you locate the right specialists. Websites, reviews, and local listings can aid in finding a skilled orthopedic surgeon or physiotherapist near you. Always remember to do your research and choose a healthcare provider you feel comfortable with. Getting a diagnosis as soon as possible can significantly improve your chances of a full recovery. Your healthcare provider will be able to give you a clear understanding of your injury and the best course of action to take. So, don't hesitate if your shoulder has been causing you discomfort. Seek help and start your journey to recovery today. Once you have your diagnosis and your doctor has given you the green light to start physical therapy, it's time to introduce some simple exercises that can help with your rotator cuff injury rehab. Remember, always follow your healthcare provider's advice and never push yourself to the point of pain. The aim here is to help heal and strengthen your shoulder, not cause further damage. Let's start with pendulum swings. Stand near a table, placing one hand on it for support, bend slightly at the waist, and let your other arm hang down. Swing your arm gently in small circles, about a foot in diameter. Do this for a minute, and then switch directions. Next, we move to wall push-ups. Stand facing a wall, extend your arms, and place your palms against the wall at shoulder height. Bend your elbows to bring your body towards the wall, then push back to the starting position. Aim for 10 to 15 repetitions. Towel stretches are also great for flexibility. Hold one end of a 3-foot-long towel behind your back and grab the opposite end with your other hand. Pull the top arm upward to stretch your lower arm. Do this 10 to 15 times, then switch arms. Doorway stretches help in increasing the range of motion. Stand in an open doorway, stretch your arms out to the side, and grasp the sides of the doorway. Lean forward until you feel a gentle stretch. Hold for about 15 to 30 seconds, and then stand upright again. Repeat this a few times. Another effective exercise is resistance band pull-downs. Stand up straight and hold a resistance band with both hands, stretching it overhead. Pull the band down, expanding your chest and squeezing your shoulder blades together. Do this for 10 to 15 reps. Finally, scapular squeezes. Stand or sit with your back straight. Squeeze your shoulder blades together as though you're trying to hold a pencil between them. Hold for a few seconds, then release. Repeat this 10 to 15 times. These exercises can be done at home and will go a long way in your recovery process. But they are not a substitute for professional medical advice. If you feel any pain or discomfort during these exercises, stop and consult your healthcare provider. Next, we'll talk about maintenance and prevention. But before we move on, don't forget to share this video with someone who may find this helpful. Let's continue our journey towards a pain-free shoulder. Now that you're on the path to recovery, it's equally important to focus on maintenance and preventing future injuries. Continuing with the exercises we discussed, even after your rotator cuff has healed, can be beneficial. These exercises not only strengthen your shoulder but also improve your range of motion and flexibility, thereby reducing the risk of re-injury. In addition to exercises, it's essential to maintain good posture at all times. Whether you're sitting at your desk or picking up a heavy object, always ensure your back is straight and your shoulders are relaxed. Poor posture can put unnecessary strain on your rotator cuff and lead to further injury. You should also incorporate shoulder strengthening exercises into your regular workout routine. This could include weight training with light weights, or resistance band exercises focusing on your shoulders and upper back. But remember, always warm up before any exercise, and never push your body to the point of pain. Diet also plays a significant role in recovery and prevention. Eating a balanced diet rich in proteins, vitamins, and minerals can aid in tissue repair and build strength. Remember, consistent care of your rotator cuff is a long-term commitment and not just a solution to an existing problem. Be patient with your body, and it will reward you with pain-free movement. Stick around for more videos on recovery and wellness. And if you found this video helpful, don't forget to like, share, and subscribe to Treatment Explainer. Thanks for watching, and take care of that shoulder. And that brings us to the end of this video. We hope you found it informative and helpful. Remember, there's no substitute for professional medical advice. If you're in pain or struggling with a rotator cuff injury, reach out to a healthcare provider. Here's to a healthier, stronger you. Until next time, this is Treatment Explainer, signing off.